and welcome to the Art of Being Human. We're going to continue on drug addiction and the dangers of drugs, and I'm going to be talking about over-the-counter drugs as well as the illicit drugs that people take. And to begin with, I think I want to show you some numbers. I neglected to do this last week, but when we were doing suicide, I showed you regularly numbers that had to do with suicide prevention and suicide hotlines and veterans hotlines and so forth. So these have to do with substance abuse. The national hotline, substance abuse, is 1-800-662-4357. And the New Hampshire Narcotics Anonymous, this is for drug use in the state of New Hampshire, 603-645-4777, and Alcoholics Anonymous, 1-800-593-3330. And you can get help from any of these organizations, and we'll be showing this from time to time as I go through the things on drug addiction. Now, we have to remember that we have to be careful about dosages of over-the-counter drugs, and I want to go into that. There is a true story about a woman who had the flu, and she felt terrible. She had all the flu symptoms, but she didn't go to a doctor. She decided she could medicate herself at home. And so she took over-the-counter drugs, which many of us do, and if you take them in the right dosages, you're pretty safe with them unless you have an allergy. She probably overdosed a little bit because she was feeling so sick. What's an extra pill? What's an extra pill? So she took some extra pills. I don't know which drug it was, but it was a drug that was deemed safe enough that they sell it over-the-counter without a prescription. Well, within a few days, she started feeling really sick, and she went into complete liver failure because of the fact she got a little bit too much of an over-the-counter drug. If it says 2 pills every 6 hours, do not take any more than that. These drugs are specially measured as to what the safe dosages are. And if you go above the safe dosages thinking, well, I'll feel a little better, more is not better. More is dangerous. And she ended up, in order to save her life, she had to have a transplant. And once she had the transplant, now she has to take anti-rejection medications for the rest of her life, just because she took a little bit too much. Oh, I don't know how much was a little too much, but she overdosed, probably not greatly, but somewhat, on over-the-counter drugs. Now, some of the drugs are like 1 pill every 4 hours or 2 pills every 6 hours. Always read the dosages. And you've got to remember, what if you're taking herbs? What if you're taking something that you can get in a health food store that's supposed to be helpful? You have to remember that those herbs are very, very powerful, and they mix with the drugs that you may be taking with a prescription. And they can either enhance the drug's effectiveness, or they can diminish its effectiveness, or they can kind of turn into a poison in your system. And the result of that is that you can get very, very sick. So therefore, watch the herbs. If you are taking herbs, and I congratulate you, because the natural way is usually the better way, but if you don't know what you're doing, you can get into the same kind of trouble as if you were taking drugs, regular drugs with a prescription, because of the fact that they are strong, they act like a drug, and most of our drugs to begin with, most of our prescriptions years ago were herbs, and that's what they made them from. And sometimes the medications that we have now are exactly the same thing as what the herbs used to be, except now they're synthesized in a laboratory. So how the herbs interact with what you're already taking, even when the food that you're taking, makes a big difference as your outcome and how that's going to be. So get supervision. Go to somebody who knows herbs, that's been trained in them, that knows what they're doing, because you could really hurt yourself if you don't. And even the food you eat could be affecting what you have. Now, there are some diets that I don't quite trust. Some diets that say you have a lot of protein and you don't have much carbs, and that's the way you lose weight. Well, the problem is is, if you have certain medical conditions, you can't have a lot of protein. If you have a kidney problem and it's a severe kidney problem, you may not be able to eat protein at all. But if you go on an all-protein diet for the sake of losing weight, you don't have to count carbs, then you can really get yourself in trouble medically because your body can't handle it. There is a new diet out, and it's called, I think, the keto diet, something like that. And I've been concerned about that diet for a long time, as soon as I found out about it, because what they do, I think, now I'm not an expert in it, I'm only beginning to learn about it, but I think they starve people from having too much carbohydrate. They don't have carbohydrates, it's high protein and fat. And then the body burns off the fat for energy, and then you lose a lot of weight, and people like it and they think it's healthy, and I hear all things about it on Facebook that are good. But what they don't realize is that if you don't have enough carbs in your diet, the body wants carbs. The body was made to digest carbs. If you don't have enough, you can build up ketones in your system, and ketones are dangerous. They're acidic, they're substances, they can get into ultra-high levels in your body, and then you can get into very, very serious health problems. You know, if a diabetic doesn't have enough carbs in their system and they're burning off fat, it's called ketoacidosis, and it's considered to be a medical emergency. And they get you in the hospital, they give you IVs, they try to reverse it because it's considered to be a very, very dangerous thing. So my question is, and I don't have the answer to it, but I'm curious about it, if you're on the keto diet, could you get to the point where you don't have enough carbs and you start to burn fat? Is your body reacting, and could you end up by having something similar to ketoacidosis? I don't know, but I'm concerned about it. I heard one report over the television, one medical report that said if you're on the keto diet, you may want to think twice before you continue it. And I know what they're referring to. Diabetics get this, both type 1 and type 2, and I was very close to it when I was in the hospital this last summer, and the nurses are running around like crazy. What can we do? She's close to ketoacidosis. And I said, you know, type 2s don't get this. And they said, oh, yes, they do. So it is prevalent. It's prevalent in pregnant women who can't have a normal diet because of the nausea that they feel. It's people who are really trying to cut carbs for the sake of losing weight and not getting too much sugar in their system. They're prone to it. So it's not just diabetics that have it, although diabetics do get it fairly frequently if they're not careful. And so you could have a problem. So it's just something, and I'm not telling you what to eat, I'm not telling you what to do, I'm not your physician, but this is something that has raised its head along with the keto diet. And if you are doing the diet, you may want to get some supervision just to make sure that you have enough carbs in your system that your body won't react that way. I know in severe cases of ketoacidosis with a diabetic, what happens is that you develop severe dehydration and the sugar levels go sky high, and a lot of people don't make it. They just die from it. So it's just something for you to consider. As I said, it may be perfectly healthy for perfectly healthy people, but for diabetics and other people, it might be a little dangerous. Just like these diets that are high protein, low carb, there are several of them out there, and if your body can't take the protein because of kidney problems, it's not the diet for you. So we are affected by everything that we take in, whether it's prescriptions or whether it's food or whatever it is. We are basically have a reaction to everything that we take. Some people eat a lot of carbs, some people eat not enough carbs, some people have too much protein. There was a diet out there that I started with a lot of other people, and we were getting sick. And the reason we were getting sick, and a lot of people who tried it thought it was wonderful, but for those who were getting sick, they were getting too much iron. the diet was loaded with iron, and you can only have so much of anything or you're going to get sick from it. So whatever you do, just monitor yourself, seek out people who can help you, who know what you're doing, who understand what the dangers are, so you don't go awry and get yourself sick. Now, I do want to go into normal medications that people take, such as the NSAIDs, aspirin, the opioids, the corticosteroids, things like that, and tell you what the dangers are. And I'm not telling you not to take them. I'm just simply saying take them with supervision or watch your dosages so you don't get into trouble, unseemingly into trouble. Okay, so when you're in pain, the last thing you need is another worry. So here are some hidden dangers of some of the most common drugs that are used in treatment. If you're under a doctor's care, they'll be monitoring you anyway. If you have a problem, you call the doctor, they change it. What about acetaminophen? A very common medication that's found in several kinds of pills. For example, it's found in Tylenol and Excedrin, Percocet, Sudafed, Lortab 600, and other over-the-counter medications. What can it do? Well, if you get too much, it can cause acute liver failure, more liver failure than all other medications combined, so that's quite a bit. And even a little dosage, a little over the recommended dosage, can cause liver damage. So with acetaminophen, follow the dosage carefully and don't take too much. If you're taking Tylenol or Excedrin or Percocet, Sudafed, I remember taking Sudafed for hay fever, Lortab, and other medicines that are over the counter. Now, they're safe enough so that they're not under prescription. You don't have to have a prescription to get this. But on the other hand, if you don't follow the dosages, you can be in trouble. Now, the NSAIDs, NSAIDs, and it stands for non-steroidal anti-inflammatory drugs. Aspirin is one of those. It's not a steroid, but it's anti-inflammatory. And it's a wonderful drug. Aspirin helps an awful lot of people. I take one every day for my heart, and I don't take it for pain, but I take it for my heart. You find the aspirin, and ibuprofen has a lot of aspirin, naproxen, Celebrex, and other COX-2 inhibitors. So those are the ones that will have the aspirin in it. Now, taking them over a long time triples your risk for having a stroke, even if you have the normal recommended dose. Patients who had Celebrex had twice as many heart attacks as those who were taking a placebo. So there are some hidden dangers even there. What about the narcotics, the opioids? We are talking about hydrocodone, methadone, oxycodone, etc. What it does is give you drug dependency, and older patients have a higher risk of bone fracture, heart attack, and death. I remember one announcer. He did this as a joke. They had to pretend that, and they're training to become radio or TV announcers. They were in training for that, and so therefore he was talking about drugs and so forth. It was just a training program, and he said, if you take this drug, it'll cause you death and other serious side effects. And of course, he meant that as a joke. Now, the corticosteroids would be the cortisone injections. Injection in the cortisone can crystallize and cause pain and cause whitening of the skin at the injection site. I know you're only allowed so many cortisone injections within a certain period of time because it thins tissue. How much do you want tissue that is injected to be thinned out? You know, and how much is safe. There is a limitation as to how many steroid injections you can get. And by the way, they're terribly, terribly painful. But people do use them. And I've had one in a finger that I injured, and I almost thought I was going to die. The pain was so great. But at any rate, it did work, and it made things better. So those are drugs that we normally take over the counter without thinking anything about it. The idea is that if you get it over the counter, you're safe, because otherwise they wouldn't be selling it. However, the dosages are very, very important, and if you go over the dosages, you may end up by wishing that you hadn't. So going on from here, the word drug, as we use it in medicine, refers to any medication or any substance that does certain things for you that are good for you. For one thing, it can cure or arrest a disease so that you don't have problems with the disease, you feel better. It can relieve symptoms. It can ease pain. And there are other benefits too. It may correct a deficiency that you have. Some people have a deficiency in the vitamin B that they take. They don't have enough vitamin D, and so therefore it can correct deficiencies. And this, by the way, also includes vitamins and minerals. And so therefore there's a legitimate use for all of these. There's a legitimate use, as it turns out, even for marijuana. Marijuana, there's certain forms of it, certain substances in marijuana that can be processed that have a good medicinal effect without getting the patient high. The idea is not to get high, but to help a person. And for a lot of people, it helps them with pain. And for some people, it's the only thing that works against seizures. I know of one case where a child was having seizures all day long. They couldn't do anything because of seizures, and it was a young child. Someone had to be with them, and the only thing that would stop the seizure was a certain type of processed marijuana, and that would stop the seizures from being 50 or so a day to maybe 1 or 2 a day. So therefore, there is usually a good portion of most substances that can be used for medication. I'm going to show you something. I just brought it in. You know, whenever I go to a doctor, they always ask me the same question. Sometimes I'm walking down the hall and they say, oh, by the way, do you smoke? Well, they know I don't. I've been to them a number of years, but they always have to ask the question. The problem with smoking, and of course I've never smoked a cigarette in my life, and I certainly wouldn't start now, but smoking is dangerous to your health because it closes off blood vessels. Now I want to show you this. We're used to seeing photographs of the lungs, just diagrams of how the lungs are shaped, but I want to take a look at this, if we can get that up. These are your lungs with all the blood vessels, the veins and the arteries. And you can see this is a part, it looks like the aorta of the heart right there and right there. These are the lungs. And you can see it's just loaded with blood vessels, both arteries and veins, in the color red and blue. And so what smoking does, it closes off your blood vessels. And then when the blood vessels are closed off, you're not getting circulation. And you can lose your fingers, you can lose your toes. And as a result of that, things get necrotic, things die, limbs die, and you can actually have part of your body fall off because it's dead. You know, and so you have to watch smoking. There is a disease called Buerger's disease. Buerger's disease is caused by smoking, nothing else. If you don't smoke, you can't get it. The only cure for it is to stop smoking. And if you stop smoking, if you haven't gone too far, you can have some recovery. But if you continue to smoke, your blood vessels will close. When your blood vessels close, you have no circulation. The cells are not getting any nutrients. The cells die. The part of your body that is dying is going to turn gangrenous. It'll turn black. And then you lose it. You absolutely lose it. I have never smoked a cigarette in my life, and I was having some vascular studies done because of the diabetes, and we mentioned smoking, and I says, you know, I've never smoked a day in my life. And he said, well, he says, I can tell you the difference between those patients that I have that have smoked and those who have not smoked. And I said, well, what's the difference? And he said it as a joke, but it was serious too. He says, they don't have near as many toes as you do. The blood vessels in the peripheral areas, like your fingers and your toes, start not to get the circulation, start to get necrotic, turn black. They have to be taken off. and so you start losing your toes. And when you start losing your toes, it's not long before you start losing part of a foot, and then it keeps on going from there. Smoking is absolutely dangerous, and not everybody's going to get Berger's disease that smokes, because it's considered to be fairly rare, but it's 100% if you have it. And if you keep smoking, it's just going to get worse and worse. So I thought it would be interesting to see this photograph of the lungs and the amount of blood vessels that are actually in the lungs, because the blood goes from your heart blood, pumps your blood all over your body, and then when the oxygen is used up, it's pumped back into the heart and lung area to be aerated once again, and then to move back out to the body again. So your lungs are giving the air that your blood cells need in the blood, and the blood travels around and takes care of the cells, and then comes back to the heart area and lung area to be aerated once again. So if you lose those blood cells, or if you lose those capillaries and tiny blood vessels in your lungs, then you are in danger. Everything that you put inside you has an effect somehow. So let's go on with this. Drugs with less potential to cause harm can be sold over the counter. That's your Tylenol and your aspirin. But as I said again, it can be a problem if you don't watch the dosages. Powerful drugs need medical supervision, and then you have to get prescriptions for those. Drugs that cause dependence usually cannot be obtained legally. They will not sell a drug over the counter that you're going to get hooked on easily. And in the past, most drugs came from herbs anyway, and they extracted the herbs from plants. And so if you're taking herbs and you're still doing the same thing, then you are interacting, those are going to be interacting with the prescriptions that you're already taking. Now, most medications are now developed in laboratories through a chemical process, and so therefore they're much more precise. I can remember years ago, and I'm not sure that it's still there now, women who had menopause were taking Premarin. And it eases the menopause symptoms if they're severe, because it has natural estrogen in it, and it helps to replace the estrogen that you've lost if you've had a hysterectomy, or if you're going through menopause and your body is screaming for estrogen that it's not getting. And if I remember correctly, it came from the urine of a horse. It came from the urine of a mare, of a horse, the female horse. So therefore, now I think everything is done synthetically, and it's done in a laboratory. Well, we're getting out of time. I'm going to close it here, and we'll be putting those telephone numbers back up on the screen for you. We're going to continue with drugs and its effect on our system and how we can protect ourselves next time. Please join me then.